Do you have lip lines that bother you, or do you want some more volume in your lips? Well, lip filler is a very easy way to accomplish that in just 30 minutes. I'm going to show you a new technique to really plump up the lips. So we have our patients numbing with some ice. We've got our filler right here. You can see that you don't need to be afraid of lip filler. I always tell people that if you think you don't want to do it because you're afraid you're going to get duck lips, those people that have duck lips have had too much filler. And you will see your filler results immediately. So we can't overdo it. If you're seeing them and you're like, that's enough, then we're done, and they're not going to be ducky. So I always like to have people have a mirror at the end or in the middle, and that way you can really see what we're doing the entire way. So it's a nice collaboration between the doctor and the patient. So how do you feel? You feel ready to try this?
Mm-hmm.
All right. I'm going to start right up here, okay? 1, 2, 3. I love right there. Awesome. And here we go. This lip filler is made with hyaluronic acid, which is what we have in our skin to begin with. However, we also have an enzyme that breaks it down, so we lose it as we age. And we stop making hyaluronic acid as much as we used to as we age too. So lip filler will naturally just dissolve on its own. So there's nothing you need to do to, it just goes away because of the enzyme we have in our system. You okay?
Mm-hmm.
Am I killing you, or is it tolerable?
Tolerable.
Great. And you're doing awesome. And this is one syringe we're going to put all over her, in her lips today. And each syringe is 1/5 of a teaspoon. So it's not a lot of product. You can always add to it. After lip filler, people tend to swell the next couple days. And then after day 3, you'll see what your lips are going to look like then for the next 6 to 12 months, depending on what filler we use. There are some fillers that last longer than others, and there are some things that you can do to help it last longer, which would be don't use straws, try to avoid whistling and doing puckering activities, like as using small bottle tops. If you have a water bottle that you always use that has a really tiny top, then you would want to use maybe a Hydro Flask. But you can see how cute just that one part of her lip is. Now we're going to go to the other side. You okay?
Mm-hmm.
Let's go over here. And I've only used 0.2. We have 1.0, which is 1 milliliter of filler in here. Here we go. Sorry. And we're going to just bring those lips right up. Sometimes people have lip lines above their lips. She's too young to have those now. But lip filler, I would do it differently if we were doing injections for lip lines. I like to use what's called a cannula and come in from the side to lay the lip filler across the lines like that. But this is actually, this technique helps to really volumize and lift. And with our patient's age, she just wants them big plump lips. So it's really cute. She's doing a great job. Are you okay?
Yeah, it's good actually.
There's lidocaine in here, so you're going to feel numb. Your lips will feel numb for about an hour after too. And I always tell people, try not to, for the next 3 or 4 days, use any straws or do anything puckering wise. If you play the flute, don't play the flute for the next few days. You know, really let it settle in there before you start doing those kind of activities. But like, how cute that lip is. So cute.
I'm excited.
Yeah, boy, that's cute. And of course, it's going to be swollen right now, so. And like I said, it's going to swell for the first 2 or 3 days. Typically, people are like, "Oh my gosh, it's swollen," and they get a little nervous about it, and then it settles down, and then they go, "Oh wait, I liked it when it was swollen." So then, typically, people come back and do another syringe. So usually, what happens? Okay, we're going to go bottom now. Okay. Here we go. 1, 2, 3. And people like to have a bigger bottom. Naturally, if your upper lip is considered 1.0 in height, your bottom should be a 1.6, and that's natural. So we do want to have a bigger bottom than a top, and that looks young. That's how we start. We all start young, right? So you're doing just great. Sorry about that.
Okay.
That one was a little pinchy. And you can also layer filler for your lips. So right now we're using something called Ultra. This can last 6 to 9 months. There's one called Volbella. It can last for up to a year. The first time people, sometimes they want to do the ones that last a little less long. I'm going to turn you a little bit to start. And then also depends on what you want. If you want more structure, Ultra is the way to go. If we want more plumpness in the lips themselves, Ultra is the way to go. If you want more lift, then Volbella is the way to go. And then sometimes people put Ultra in and then they come back and they do Volbella. It's like making the cake with the Ultra and then you ice it with the Volbella. So you can layer them. Sometimes people do, they say, okay, let's do a syringe now, and instead of waiting for 6 months to a year for it to dissolve on its own, they come back in about 4 months and they do another syringe, and you just keep adding, but have it look natural. You definitely want to look natural. We never want people to ask us, ooh, what'd you do? We want them to say, ooh, what'd you do? And then you go, oh, I got a new lip liner, I got new lipstick, and they go, oh, okay. Unless they're your best girlfriend and you tell them exactly what you did. Lots of times people want to hide it from others, and so if you do want to hide it, I always tell people, tell them you just got a new lip balm. So that's all. You've got a new lip balm that works out. Oh, those are cute.